Welcome to this talk. Now, I'm going to talk a bit about different diseases in this video. Now, this is based on this new report, or this updated report, 13th of May, from the Centers for Disease Control in the States, and it looks at different diseases, the comorbidities, because we know that people with COVID are at greater risk of severe disease if they have certain comorbidities. Morbidity means disease, mortality means death, of course. And I thought we'd just use this as an opportunity to talk about some of the conditions, if you're interested in that. Now, just before we do that, the deaths in the States are pretty high, really. I mean, as of today, the 19th of May, well, that's data up to the 18th of May, 583,000 deaths in the States. But this graphic's quite useful because it shows the proportion in different ages, and we see there it's a bit out of date. It's 568,000 died at the time of this graphic. But these are the proportions that died in various age groups. Now, 0 to 17, 287, 18 to 29, 2,163, going up as we can see. 30 to 39, 6,299, going up to the older age group. So we see a definite increase in deaths, but relatively young people. It's there are some deaths. This is a disease to be taken seriously. Now, the link for this page that we're talking about today is there. So click on that and check it out for yourself. Don't take my word for it, always check it out for yourself. Now, I'm going to talk about some of the diseases. Now, what happens here is there's various diseases mentioned, medical conditions in adults with comorbidities. And the Centers for Disease Control has simply listed the ones that are significant in alphabetical order. And I've had a bit of trouble with my printer, but I think we'll manage to see it. Now, cancer's the first one. The disease itself, so people with cancer, that's a comorbidity, and some cancer treatments can be risk factors as well. Now, cancer is a disease of out of control cell division. So you all started off as one single cell, which is a zygote. One sperm and one egg, and that divided to form I can't remember, about 70 billion or so cells in the adult body. But cell division has to be turned off and it has to be turned on. Now, in cancer, for various reasons, the cell division just keeps on going. The cells become malignant and they over-multiply. If this is in the blood, it will give rise to a leukemia. If it's in the tissues, it will give rise to a lump, which is normally called a tumour. So cancer is an over-proliferation of cell division, an out-of-control mitosis that generates these problems. And the problem with cancer is that normally cells stick together, but in cancer cells they lose this cell-to-cell adhesion and they can float away. So as well as the cancer growing locally, cells can float away in the lymphatics, and then eventually cells can actually float away in the blood, and you can get spread to different sites of the body. They will seed what we call metastases. So cancer is a metastatic condition. So that's basically what cancer is, and it's a recognised comorbidity. And cancer can be caused, of course, by things that cause cancer, and these are called carcinogens, such as ionising radiation, certain chemicals, certain substances such as asbestos. But back to the list, chronic kidney disease, CKD. So this is long term. Now, sometimes the CDC here break it down, and sometimes they don't. So they just call chronic kidney disease chronic kidney disease. But chronic kidney disease is a long-term reduction in renal function. So the kidneys filter the blood. They take out the toxins from the blood, and of course they produce the urine. And in chronic kidney disease, their ability to do this goes down. And if it goes down sufficiently, then people can need dialysis to support their renal function. And there's many causes of chronic kidney disease. Most places, the most common cause is going to be Well, it depends on the area, but the two common causes, the two really common causes are chronic high blood pressure and poorly controlled diabetes mellitus. Now, the thing about those conditions, about high blood pressure and diabetes mellitus, they are both eminently controllable diseases. So if you take if you adjust lifestyle and take medications to bring blood pressure down, then that's going to slow the progression of renal compromise, of renal damage. And likewise, if you can keep the blood sugar levels down in diabetes mellitus, whether it's type 1 or type 2 diabetes, that will also slow down the chronic kidney disease. Many other causes as well, such as infection, especially in childhood. Chronic lung disease, also very common. And the CDC actually itemise a few here. Chronic obstructive pulmonary disease. So pulmonary just means to do with lungs. So chronic obstructive pulmonary disease is disease of basically it's disease of the bronchial tree. So the air's got to go in and out of this bronchial tree. And these passages here of the chronic obstructive pulmonary disease, these passages are narrowed. And you can get loss of cilia and ultimately fibrosis in those passages, causing chronic obstructive pulmonary disease. And it's obstructed because the airflow is obstructed. It's harder for the air to get in, and it's particularly harder for the air to get out. And chronic obstructive pulmonary disease is often divided into chronic bronchitis and emphysema, which are slightly different aspects of chronic obstructive pulmonary disease. Asthma is an inflammatory disease of the airways. Very often it's acute. You get an acute inflammation of the airways with swelling, which can restrict the lumen in the airways, making it difficult to breathe. And of course, acute asthma is a life-threatening condition. And there's chronic asthma as well, where that occurs over longer periods of time. Now, the CDC talk about interstitial lung disease. What this actually means is where there's fibrous tissue growing in the lungs. So we would normally talk about pulmonary fibrosis, but that's the term that they use. Another cause of chronic lung disease is cystic fibrosis. Now, cystic fibrosis is a genetic disease, and the proper name for cystic fibrosis is mucoviscidosis. Many of the secretions in the body become thickened. So like the mucus in the lungs becomes thickened, the secretions from the pancreas become thickened. And because they're thick and tenacious, they don't clear as well. So you've got stasis of sputum in the lungs. And when there's stasis, that attracts infection. So these people often get chronic infections, unfortunately. So that's cystic fibrosis. It's entirely genetic. Pulmonary hypertension. Hypertension is high blood pressure in the blood vessels supplying the lungs, and it can be the veins draining the lungs as well. High blood pressure associated with the lungs. Now, I suppose COVID is a respiratory disease, so it's not surprising that these lung conditions are going to compromise lung function. That's not surprising, really. And I forgot to mention at the time, but some cancer drugs will reduce immunity as well. But just having cancer is also a risk factor. Dementia and other neurological conditions. Now, of course, there's many neurological conditions. Neurological conditions just mean a disease of the nervous system, whether the central nervous system, which is the brain and the spinal cord, or the peripheral nervous system, which is any neurological tissue in the body which is not part of the brain and spinal cord. Dementia can be usefully defined as a progressive, irreversible impairment of intellectual function. So it's progressive and it's irreversible in dementia. And these patients are more prone to severe COVID. There again, they often tend to be older, but not even accounting for age, they have more severe COVID than other people of the same age. Not entirely clear why that is, but it is the case. So diabetes, otherwise called diabetes mellitus or sugar diabetes. Now, there's two types of this. There's two types. There's type 1 and type 2. Type 1 is generally an autoimmune disease where the immune system actually destroys the beta cells in the pancreatic islets of Langerhans. And the beta cells in the pancreas are the ones which produce the insulin. So if the immune system beats up the beta cells, then the only insulin producing cells in the body are destroyed, so there's an absolute deficiency of insulin. It's insulin which lowers blood sugar levels, therefore blood sugar levels go up, and the patients also become ketotic. They develop ketosis, and a condition called ketoacidosis. That's the one you can sometimes smell on the breath. It's that acetone smell. You get the same smell when people are breaking down fats when they're malnourished, if they're fasting or unable to get food for a period of time. So that's type 1 diabetes. That's in the UK. That's about, well, it's the least common type. Probably less than 10% of people with diabetes have type 1. But that's absolute insulin deficient, and before insulin was discovered, or if insulin is not available today, these people will die, unfortunately. Type 2 is we used to call that maturity onset diabetes. It's not really a good term, but it usually starts off as insulin resistance and goes on to insulin deficiency over time. Type 2 diabetes is not always, but is often associated with obesity. And there's a complete pandemic of type 2 diabetes. I mean, at the moment, from memory, it's about 9% of the world's population has got diabetes, nearly all type 2s. Really, we need to get a grip on this, because diabetes is associated with all sorts of complications. So you can get renal failure, you can get blindness, you get cardiovascular disease, you can get cerebrovascular disease, you get peripheral vascular disease, resulting in it can result in amputation. You get peripheral nerve disease. But all of these side effects are less when the diabetes is well controlled. The trouble is with type 2 diabetes, some people can develop type 2 diabetes and not know they have it. This is why we should always test blood glucose levels as part of any routine medical examination. So if you think you are at risk from high blood pressure, or if you think you're at risk from diabetes, for goodness sake, get it checked. You know, the main clinical feature of high blood pressure is no clinical features, so you just have to get it checked. And it's the same with diabetes. You might be feeling a bit under par, but it's come on so slowly that you don't realise, and it's always worth getting your blood sugar level checked to make that diagnosis. Down syndrome. Down syndrome is a genetic abnormality. It's associated with increased maternal age. Very often it's a trisomy 21. So you've got 23 pairs of chromosomes, 46 chromosomes altogether. In Down syndrome, you've got an extra 21st chromosome in some people. That's called trisomy 21 syndrome, or sometimes there's not a complete new chromosome. It's what we call a translocation mutation, and they have some extra 21 chromosome. So basically they've got too much of the 21st chromosome, or an extra 21st chromosome. And of course, Down syndrome children and people are very often are some of the most lovely people I have known. They are usually gentle and loving people, and although it's a tragedy that it happens, let's just say that I've had relationships with people with Down syndrome that has improved the quality of my life as friends. Right, moving on to heart conditions. Heart failure. Heart failure is where the cardiac output is insufficient to meet the metabolic demands of the body. So, of course, the body needs oxygen and it needs nutrients, and the only way they're going to get there is in the blood. So the heart must generate sufficient cardiac output to meet the metabolic demands of the body. And when the heart output is insufficient to meet the metabolic demands of the body because the heart is failing, it can no longer generate a sufficient cardiac output. Then that is heart failure. And it's also associated with congestion of the veins as well. A coronary artery disease. That is disease of the coronary arteries that supply the myocardium. So the myocardium is the muscular layer of the heart, and of course it's contracting all the time. But the only way that the myocardium can contract if it has its own energy supply, its own muscle supply, that gets there through the coronary arteries. And if those arteries are furred up, so if those arteries are narrowed, less blood is getting through. That's called ischemia. Very often the arteries are furred up by what we call atheroma. The disease process is called atherosclerosis. If you're interested in these things, before COVID started, I did detailed videos on all of these. So check around on my channel and you'll find very detailed videos on heart failure coronary artery disease and all this interesting things. Cardiomyopathies. Now, cardio, heart. Can we see that? Myo, muscle, pathy, disease of. So cardiomyopathies are disease of the heart muscle, the contractile myocardium. So, for example, it could be caused by Coxsackie viral infection or other viral infections. It can be caused by chronic alcoholism or vitamin B deficiency. So cardiomyopathies, disease of the heart muscle itself. And of course, hypertension simply means high blood pressure. High tension, when the blood pressure is too high, there's progressive damage to numerous tissues of the body. Always need to get your blood pressure checked as part of any medical. Losing weight and exercise can help high blood pressure, but of course medications are very effective for reducing high blood pressure that your doctor can prescribe. These are readily available and they are cheap and can make all the difference. Now, quite why these heart conditions are affecting COVID is a little less clear, but of course we know that there is compromise of the circulatory system in COVID-19. So I guess it's this kind of double whammy idea that these things are causing more severe disease. HIV, human immunodeficiency virus, can cause acquired immunodeficiency syndrome. It's a viral infection. HIV virus. It's transmitted typically in body fluids. It can be transmitted sexually. It can be transmitted through sharing dirty needles with intravenous drug users, or it can be a contaminated needle. And tragically, there's been cases of people that have acquired this through low quality healthcare in some parts of the world. Now, we can't eradicate HIV because what happens in HIV, it's an RNA virus, it's a retrovirus. And that means that the RNA actually codes the other way and it goes into the DNA. So the DNA, you actually get HIV virus DNA in the person's genome. And there's no way to get rid of that at the moment. But what we can do is give antiretroviral drugs, which keep the antiretroviral load down, keep the HIV virus load way down. And people can live a normal life. Well, I haven't been to one of these clinics for a long time, but certainly for decades. Highly active antiretroviral drugs, complete revolution in AIDS, HIV care. Before that, there were so many tragic deaths from HIV and often very young people dying, but now can be kept alive with good health for many decades. Just started thinking of Freddie Mercury for some reason. If you're a Queen fan, he died tragically young, and just a few years later, he could have been treated with antiretroviral drugs. Right. The first person I looked after with HIV was actually it was in the really early days. It was 1980. I'm not sure, was it 82 or 83? I think it was 1983, the first patient with HIV in our hospital. I looked after the first ever HIV patient in my city. Right, immunocompromised patients. So clearly HIV is going to compromise immunity, that makes sense. It's an acquired immunodeficiency syndrome. Other immunocompromised, primary immunodeficiency is normally genetic. Prolonged use of corticosteroids, the steroid drugs can reduce immunity, and other immune weakening medicines such as those given to people who have had transplants, for example, renal transplants. Next group of people with comorbidities, liver disease. Again, chronic liver disease. Now, this can be alcohol-related liver disease. What happens in alcohol-related liver disease is that the liver cells, when there's alcohol in the blood, the liver cells can take in fat as normal, but they can't export the fat, they can't process the fat. So they take in the fat, and the alcohol stops them processing, exporting the fat. So the cells all grow and fill up. They fill up with fat. They become fatty. You get fatty liver disease. And that causes a condition called hepatomegaly. The liver becomes enlarged, and of course the liver is there underneath the right costal margin. So You can learn to feel that, and if it's enlarged, you can learn to feel it. The liver becomes enlarged. Now, the good thing about, well, not the good thing about alcohol, but as long as you stop it early enough, then that fatty, if you stop drinking, the fat will go down and the liver will shrink. But if you wait till the liver becomes scarred, that's called cirrhosis, then that's irreversible. So the steatosis, the fatty liver, is reversible. So if you've been drinking too much, you can stop, and your liver can make a massive, massive, brilliant recovery, unless you've carried on drinking to the point where it's become fibrosed. In that case, the fibrosed part of the liver won't make a good recovery at all. Fat won't recover. Hopefully other parts of the liver will, so there's always advantage to stopping drinking. But that is the thing with alcohol. And that's another reason why it's important to have if you do drink alcohol, have long breaks from drinking alcohol, certainly several alcohol-free days in the week. Because when there's no alcohol in the system, the liver cells can start exporting the fat again. And then the liver cells will go back to their normal size before they die and become fibrosed. Fibrosis just means scar tissue. So you get a scar on the surface of the body. That's fibrosis. Fibrosis is just scar tissue. But so basically you get a scarred liver. But livers have remarkable powers of capacity to regenerate if you take away the insult, and alcohol in this case is the insult, early enough. Non-alcohol related fatty liver disease, what we used to call cryptogenic fatty liver disease. Now we know this is largely associated with high sugar intakes, perhaps particularly fructose and high carbohydrate diets. So non-alcoholic fatty liver disease. And cirrhosis is the scarring of the liver. So all of these things. Now the liver basically is the factory of the body. It's the chemical factory of the body. So if there's a problem with the liver, it kind of makes sense that the body biochemistry might not be quite where you'd like it to be, because, you know, the liver basically carries out basically all biochemical function, or not all, but you know, the majority of biochemical functions in the body. So, for example, ammonia from nitrogen metabolism is converted into urea in the liver. It's the liver that makes the plasma proteins. So I used to tell students that if you ever get a question on where some aspect of biochemistry happens, just say, "Oh, the liver," as if it's an obvious question, and you're usually right. Okay. So anyway, that's a risk factor. Overweight and obesity has turned out to be quite a big risk factor, and the more overweight and the more obese, the greater the risk factor. So overweight, some increased risk; obesity, some increased risk; severe obesity, even more increased risk. Now, it's turned out pregnancy does have an increase in risk for at least 42 days following the end of pregnancy. Now, of course, this is the 6-week period. This is not my specialism by any means, but there's this classic period called the puerperium, which is the first 6 weeks after pregnancy. So, like, if someone gets a psychosis in that period of time, we call it puerperial psychosis. If they get an infection in that time, we call it puerperial infection. And of course, puerperial sepsis used to be a huge cause of death. Still is in some parts of the world, unfortunately. The odd case does slip through medical care. But interesting that classic time, that puerperium, there is some element of increased risk there. Sickle cell disease or thalassemia, these are both entirely genetic. So sickle cell disease is where the red cells cease to become biconcave discs, and they literally be. So instead of being nice round biconcave discs for the erythrocytes, the red cells, they do become sickle-shaped like that. So sickle cell disease, and thalassemia is actually a genetic disease, not of the whole red cell, but of the hemoglobin that makes up the red cell. So again, both diseases of the blood, so it vaguely makes sense that people could get more severe COVID with the diseases of the blood. Smoking is generally a bad idea, and it's turned out to be so here. So smoking, current and former smokers have higher risk. Many reasons for that, many possible reasons for that. I mean, nicotine, for example, is vasoconstricting. It reduces blood supplies to the area. Another reason could be the carbon monoxide in cigarette smoke. So when people smoke, they inhale carbon monoxide. That combines with the hemoglobin in the blood. That forms a compound called carboxyhemoglobin. That's a relatively stable compound, and while the hemoglobin is tied up with the carbon monoxide in the form of carboxyhemoglobin, of course that means it can't carry oxygen, so you get a reduced oxygen carrying capacity of the blood. But many other reasons why smoking's not a good idea. But everyone knows that now. But it's turned out that smoking is also a risk factor for more severe disease. Solid organ or blood stem cell transplants. So solid organ transplant with people who've had a heart transplant, lung transplant, kidney transplant, whatever. And blood stem cell transplants. Now, I'm unclear whether the CDC don't give a lot of information on this. How long after transplant this is, I assume it is somewhat of an ongoing effect. Because certainly for solid organ transplants, these people have to take immunosuppressing drugs. The reason for that is, of course, if you get someone else's organ, that's a foreign tissue, and your immune system will recognise that as being foreign and will try to reject it. So it's necessary to give drugs to suppress that. Great steps are taken to try and provide a good genetic match to minimise the effect. But the only way you'll get a perfect match is if you have received an organ from an identical twin who's genetically identical to you, and that doesn't happen too often in these cases. So immunosuppressing therapy is necessary in that situation. Stroke or cerebrovascular disease. So stroke, bit of a bad term really, cerebrovascular accident. What a stroke is, most strokes are blood clots in the blood vessels that supply the brain. So part of the brain is deprived of the blood supply. Sometimes a stroke can be hemorrhage as well, but most are cutting off the blood supply to some extent, what we call a thromboembolic stroke, indicating disease of the vascular system. So stroke or existing cerebrovascular disease. And the last, no, it's not the last one, they've got quite a few here. Substance abuse, alcohol, opioid, cocaine, substance abuse. I mean, this is associated with very often a poor lifestyle as well. Is this the last? Oh no, this is the last one. So that should just go to there. And children with underlying medical conditions are at increased risk as well. Thankfully less so than adults, but compared to other children of their same age group is what the Centres for Disease Control is saying. So that was a bit of a run through a few disease conditions. Now, let me just show you this site again. So this is a huge amount of information on this site here. I'm just skipping through to actions you can take. So read this yourself, make sure I've got it right. So here the CDC are giving sort of generalised advice really, actions you can take. Basically continue with your current medicines. So if you're taking medicines for diabetes or high blood pressure, they're saying you should carry those on. And there it says on their site there, continue your medications. Do not change your treatment plan without talking to your healthcare provider. So that's kind of a general principle that they're giving there. Follow your current treatment plan. Have at least 30-day supply of meds in the house. That's a good idea. Have shelf-stable food choices available. So have a bit of a food stock in the house as well, they're saying. So I think that's what they mean there. Let's have a look at that one. Have a 30-day prescriptions. Have shelf-stable food choices available to accommodate dietary needs based on your medical condition. Okay, but there are things you can click on that gives a lot more information. Know the triggers, things that make your disease worse. So what makes your asthma worse? What makes your diabetes worse? Learn about stress and coping. Always good. Easy to say, sometimes quite hard to do, but that's what they're advising. Do not delay getting an emergency care for your medical condition. You know, this is one of the tragedies of this pandemic. People have deteriorated or had acute conditions and not sought healthcare immediately, and of course that has resulted in some people dying, often when care was available. So that is really quite important piece of advice. Call your healthcare provider if you have any concerns, of course. That's the cover-all phrase that everyone says. We agree with. When possible, keep preventative care and other routine healthcare appointments. So keep your appointments. So that's general advice there from the Centres for Disease Control. So I hope that was interesting. Review of a few different diseases and to some extent how they affect the likelihood of developing severe COVID-19. But of course, there's many things we don't know about. It's still very much a learning process. Anyway, thank you for watching.